It is my great pleasure to welcome back Dr. Stephen Chung to our 2021 LIVERight Health Forum. Finding out that you or someone you know has cancer can be difficult. It can be a frightening and stressful time, and you may have many questions. Today, Dr. Chung will be talking about you have liver cancer. I have what? Dr. Chung is one of the most well-respected liver cancer and transplant surgeons, both academically and clinically. He is a full professor of surgery at UBC and has made incredible contributions to the scientific community. His mission is to help and heal people. Please join me in welcoming Dr. Stephen Chung with our host, Valeria Zaborska.
Thank you very much, Monica, for that more than generous introduction. And thanks everyone for tuning in to this educational forum put on by the Canadian Liver Foundation. And thank you for submitting your questions.
Thank you for joining us, Dr. Chung. So for the first question, do you mind telling us a little bit about what is liver cancer, what are the different kinds and stages, and what typically causes it?
Thank you for that question. Liver cancer is a very broad topic. Liver cancer can occur through cancers that originate directly from the liver, or it can be cancers that arise from other sites, such as breast, lung, pancreas, colon. In that case, the liver is merely an innocent bystander that happened to be invaded from cancer from another place. For today's purposes, I think we should primarily focus on cancers that arise directly from the liver. These are called primary cancers, primary liver cell cancers. And these liver cancers can arise from any cell that originates from the liver. The liver has many cells present within it. The two dominant cancers arising from the liver are hepatocellular carcinoma. Those are cancer cells that those are cancers that arise directly from hepatocytes or liver cells, and cholangiocarcinomas, which are cancers that can arise from the bile duct. If you think of the liver like a tree, the hepatocytes or liver cells are like the leaves of the tree, and the bile ducts are like the tree branches. And as you go out into the periphery, the branches are very small, and as you come more centrally within the liver, the branches coalesce into a big liver trunk, a tree trunk. So the most common type of cancer are those cancers that arise from the hepatocytes. And I think for most people who have liver disease, this is the one cancer that people will be most interested in. Staging cancer can be very challenging. Most of the usual staging systems don't really apply for liver cancers when we think about trying to treat them. So we have what we call the TNM stage, which is the most common way of staging cancers. But for liver cancers, that's not particularly useful. The most common staging system that we use is the Barcelona Clinic liver cancer staging system, because this takes into account what we usually think about when we try to treat cancers. That is the numbers of cancers, the size of the cancer, plus, very importantly, the underlying liver function.
Thank you. And how do you diagnose liver cancer or screen for it?
Unfortunately, most liver cancers have very little symptom in their early stages. So the most common way to detect this is by surveillance screening. That is, if someone has known liver disease, they should undergo regular ultrasound scanning to determine whether or not they have developed a liver cell cancer. So people who have underlying liver disease should undergo ultrasound scanning at least once or twice a year. Symptoms don't usually occur until late in the stages of these cancers.
Okay. And so for those who are already late in the stage before they get medical attention, what are the type of symptoms that they would experience?
They could experience abdominal pain, swelling of the abdomen, or jaundice, that is yellow discoloration of the eyes and skin. But again, unfortunately, this would mean that the cancer is fairly late in its stages.
Okay. And does liver cancer spread quickly? So for some of our audience members who have family members that have it, what is the prognosis like, and how long should they expect for their family member to live or to be healthy still?
Yeah, so some of the more rare types of liver cancer can spread quite rapidly, but again, for the more common cancer, hepatocellular carcinoma, the cancer growth is quite slow, and they tend not to spread until late in their disease process.
Okay. And probably hard to estimate regardless, as each situation is unique.
That's correct, yes. So early stage cancers tend not to grow very quickly. So there's time to make a diagnosis and time to think out some appropriate treatment plan.
Absolutely. So speaking of treatment, is surgery the best way to treat liver cancer? And what is the surgery like?
Yeah, so that's a question that when we see someone with liver cancer, we do try to think whether this is something that can be removed by surgery. But this depends upon the size of the cancer, the location, how many cancers there are, and again, importantly, underlying liver function. Unfortunately, most of the patients that we do see with liver cell cancer are not operable, so we have to think of other treatment options. But yes, if we can try and do an operation to take out the cancer, that is probably the best treatment if it's possible. To emphasize, though, unfortunately, this is often not possible. The other thing we talk about with surgery is liver transplantation. Of course, that is an operation. So whenever we deal with anyone who has liver cell cancer, we're always thinking in the back of our mind, is liver transplantation a potential treatment either now or in the future?
So you mentioned earlier that there's other options available. So this is a little bit of a loaded question, but if someone were to have a non-operable cancer and they heard about treatment options such as radiation, ablation therapy, chemotherapy, embolization, can you please tell us a little bit about each one of those treatments, what the goals are of those treatments, and what goes in to deciding which way to go?
Yes, thank you. That is a complicated question and a complicated answer. In general, we think about treatment options which are potentially curative, and under that category, I would include liver surgery, where you can take out the cancer, liver transplantation, and liver ablation. So ablation is basically temperature destruction of the cancer. This can be done with any form of energy. We commonly use microwave in Vancouver, but other places will use radio frequency, which is another form of energy, or cryoablation, which is basically freezing the cancer. These treatments, the ablations, are really only applicable for small cancers, however. But those are all potentially curative treatments. The next category we have are disease control treatments. These are applied to people whose cancers we believe are not at the moment curable. So we try to hold the cancer or put a pause on the growth. I would consider what we call chemoembolization or radioembolization or radiation therapy as treatments in this category. And then if none of those are applicable, then we think about systemic chemotherapy, which is the drugs that we give for systemic control of cancer that may have extended beyond the confines of the liver, or not applicable for treatment of any of those other treatments I just mentioned. The other, again, I just keep coming back to the emphasis, is because most of these cancers occur with people who have underlying liver disease. We also have to take into consideration what is the state of the underlying liver and its function, because that will often limit what we can or cannot do.
So, and you were mentioning radio and chemo embolization for control of disease. So does that mean that you use the energy or the chemotherapy to shrink the cancer but not necessarily remove it?
That is correct. Sometimes for people who we think are not treatable for cure at the moment. These cancers can be controlled or downstaged with some of the other treatment therapies so that they may become potentially curable. So even though if I or someone else tells you or your family member that your cancer at the moment is not necessarily treated or treatable by ablation or removing the cancer or transplant, that doesn't necessarily mean they will never reach those stages or never be able to reach those treatments. We apply these treatments either individually or sequentially to try to obtain the best possible result for the patient.
And is there any evidence that one is better than the other, or is it really tailored to the individual depending on the characteristics of their particular cancer?
That's exactly right, Val. It depends upon what the particular stage of the cancer is. So each particular stage of the cancer has its best treatment approach.
Okay, great. Thank you. I know that was a very long question. So following up on that, can you tell us a little bit about the side effects of each treatment and what to expect for someone who is told that they will undergo either chemotherapy or ablation therapy and how they can prepare for it?
Yeah, so unfortunately, the most effective treatments for these cancers are also the ones that have the highest effect on quality of life. So, for example, liver transplantation or a liver resection, that is cutting out part of the cancer, are very effective treatments for cancer if they're appropriate. But unfortunately, the side effects can be quite dramatic on the patient. They have to recover from a very large operation, and these operations do have the potential for complications associated with them. Now, if you have a small cancer and you undergo liver ablation, that's very effective. It's safe and with very few complications, and the recovery is very quick. So this is the importance of screening. If you can catch a cancer at a very early stage and you can apply something like an ablation treatment, that is highly successful. Some of the other treatments as we go on are less injurious to the person. In other words, they have less complications and less risk, but they are also less effective. So treatments like chemoembolization or radioembolization are not as physiologically stressful on a person, but they are also less effective. The same thing with systemic chemotherapy. The side effects of the chemotherapy can be troublesome, but again, not as stressful or risky as some of those other operations.
Absolutely. And what is the success rate like for each of those treatments?
Again, it depends upon the stage of the cancer and where you are in terms of its progression. If one is able to go, for example, undergo a liver transplant, the success rate is it's okay. It's not guaranteed to be curative, but there's about a 60 to 70% cure rate for liver transplantation. For someone who undergoes a liver resection, that is cutting out part of the liver to remove the cancer, the success rate or cure rate is about 50 to 60%. And liver ablation is highly effective as well, but again, in the long term, the success rate is about 50 to 60%. I should say, if you undergo liver transplant, liver resection, or liver ablation, in terms of dealing with cancer at that moment, it's probably close to 90 to 100% effective. But the reason why the longer term cure rate is not as great is because these cancers can recur. With the other treatment options like chemoembolization or radioembolization or radiation therapy, those are not intended as curative. They can happen for sure. We don't plan for them to be curative, but they can. So we have to be very careful that the cancer could come back or may progress despite treatment. And with systemic chemotherapy, again, the objective is not cure; it's more disease control. But again, sometimes unusual things happen. So systemic chemotherapy from time to time can enact a cure.
Great, thank you. So for someone who has undergone treatment, how do you or we as doctors know when they're cured, and what is the follow-up like? So how often will the patient need to be followed up in the future? How often do they need tests done, imaging done, etc.?
Yeah, that's also, well, they're all good questions, but this one is a tough one to answer. Liver cell cancer is the same as any cancer. It's hard to know if someone is cured until years later. We only tell if someone is cured because the cancer didn't come back. Now, as I mentioned, some of those other treatments are very effective in terms of dealing with the immediate problem with the cancer, but the risk of coming back is fairly high. So these people have to undergo screening after the operations or the treatments or the ablation, whatever else they've had. So it's very important that after the treatment that they continue to undergo follow-up evaluation. And the best way to detect a recurrence is by imaging, either by ultrasound or preferably a CT scan or MRI. That's the best way of picking up a recurrence. So people do need to be screened immediately after their treatment and probably for the rest of their life. Well, not probably, they do need to be screened for the rest of their life.
Okay, great, thank you. So this is a direct question from an audience member, and they're asking, so their wife is scheduled for hepatocellular carcinoma surgery in a few weeks. Is there anything they should be doing before the operation to ensure success? Are there any specific diets or activities you can recommend for the best outcome?
Yes. So if your wife is smoking, she should stop smoking. If she doesn't smoke, obviously she shouldn't start smoking. Eat normal, healthy foods. There's no specific diet, although I would say cutting out processed foods and fried and fatty foods in general is not particularly healthy. So those probably should be removed from the diet. Staying active, very important. Continuing on with the normal activities of daily living. Go out for a walk. Keep active. Keep the joints moving. Keep the blood flowing. And let's get prepared for the surgery psychologically, mentally, with good family support.
So this question ties in a little bit to a question I personally had. Is there any preventative measures to prevent someone maybe who has liver disease from developing or progressing to cancer?
The problem with having underlying liver disease is that the wheels have already been set in motion for the development of liver cell cancer. So if the damage to the liver cells has occurred, there's really not much you can do to prevent that progression. However, if general rules still apply, stop smoking, minimize alcohol consumption, maintain an active, healthy lifestyle, and get screened. I know screening won't prevent cancers from happening, but they can pick them up early. Now, if you have hepatitis B, for example, it's been shown that if you undergo antiviral therapy, the likelihood of developing a liver cell cancer is reduced. It's not eliminated, but it's reduced. Same thing if you have hepatitis C. There are highly effective antiviral treatments available. So if you undergo effective treatment for hepatitis C, that reduces the risk of developing liver cell cancer. If one has challenges with excessive alcohol consumption, with the help of addiction and drug counseling and rehabilitation, stopping alcohol consumption is also very helpful. But I think the most important thing is to maintain a good, healthy lifestyle and get regular screening.
Great. Now for our last question, also a little bit of a broad one. How important do you think that liver cancer research is? How far have we come in the recent years with research related to liver cancer? And are there any exciting developments in the works that you can share with us?
Yes, in it's hepatocellular carcinoma is a very common cancer in the world. It's very common in Asian countries, Southeast Asia, and in Canada. There's a lot of immigration, so the incidence of liver cell cancer in Canada in particular is quite high. In many European countries, there's a high incidence of underlying liver disease from hepatitis or other causes. So it's a very common cancer in the Western world and in Asian countries. So yeah, it's a big problem. Fortunately, with the assistance of research and innovations in technology, the treatment for this cancer has markedly improved over the last 10 to 15 years. Maybe 20, 30 years ago, if you said that you had hepatocellular carcinoma, that would have almost been equivalent to a death sentence. But over the last 10 to 15 years, with breakthroughs in research from technology, better surgical care, transplantation, innovations with ablation and some of the embolization techniques, and advances in systemic therapy, the outlook is good, even if the cancer is a little bit more advanced than we would like to see. So just because you have a diagnosis of hepatocellular carcinoma in 2021 does not mean that it's a death sentence. Far from it. Even people with advanced cancer can be treated so that they can have a prolonged life and with good quality of life. Often the goal of cure may not be possible, but the goal of controlling the cancer as long as possible while emphasizing maintaining quality of life, I think that's a realistic goal. The main advances going on in 2021, I think advances in drug discovery with the introduction of new systemic chemotherapy agents is a very important advance. Some of the immunological checkpoint inhibitors or so-called immunotherapy have not been particularly applicable to liver cell cancer in the past, but with new knowledge and new introductions of drugs discovered by the research endeavors, this is an opening field now to try to help with people who have a little bit more advanced cancers. So yeah, I think the future is getting much brighter, or has been a lot brighter over the last decade, and continues to look up, especially with dedicated research investigators bringing new treatments in.
Great. Well, thank you so much for ending off with such a positive message of hope. Those are all of our questions. Thank you so much for your time and for the really comprehensive answers.
Thank you very much for inviting me. It's a very complicated field, but I think if with associations like the Canadian Liver Foundation and their support for research in this area, I think the future for liver cell cancer or hepatocellular carcinoma is much brighter than it has been. So let's encourage the audience to keep supporting foundations such as those run by the Canadian Liver Foundation. So thank you again for having me.